is a 9-year-old thoroughbred ex-racer who retired in December 2019 due to a tendon injury in his right forelimb. Since his retirement, he has been out of work with no further injuries or problems. However, he has been shown to be reluctant to pick up his back feet. In the left lateral view of the scapula, Tommy's scapula measured 60 centimetres in length, compared to 62 centimetres in the right view, whilst the average length for thoroughbreds is 58 centimetres. Proportionally, a longer scapular length may predispose into forelimb lameness as the centre of weight is shifted cranially, increasing the proportion of body weight that must be supported on the forelimbs. However, a longer scapula may allow for bigger muscle insertions, increasing the muscle efficiency during movement. The inclination of the scapula to the ground measures 55 degrees, which is 11 degrees shallower than the average horse. A smaller shoulder inclination angle may allow for more efficient forelimb movement. The angle of his scapulohumeral joint was 82.3 degrees on his right, 82.4 degrees on his left. The ideal joint angle for a thoroughbred is approximately 90 degrees. A shallower shoulder angle allows a more effective forward propulsion of the forelimb. In his left and right forelimbs, Tommy's a humeroradial joint angle of 118.4 degrees. A study showed that the average thoroughbred angle can range between 124 degrees to 153 degrees. Having a shallower joint angle may cause excess tension in the collateral ligaments, leading to rupture or strains. When viewed cranially, laterally, the antebrachium has an average length of 53.5 centimetres in both forelimbs, with the radius making up 49 centimetres on average. The average radius length of racing thoroughbreds has been found to be between 36 and 46 centimetres, and a longer radius allows for a longer stride length. There is slight asymmetry between his length of carpus to floor, at 51 centimetres on his right forelimb and 53 centimetres on his left forelimb. This falls within the average length of the distal forelimb, so the slight asymmetry is likely due to human error. Tommy showed carpal angles of 167 degrees in his right and 176.6 degrees in his left. This deviation of the carpus is consistent with the findings of the plumb lines in his forelimbs. Hyperextension of the carpus joint, as evidenced in Tommy, may lead to uneven loading across the joint, increasing the risk of degenerative joint problems such as osteoarthritis. Also, joint hyperextension leads to excess tension through the tendons and ligaments supporting the joint, potentially leading to strains and injuries. When looking from a cranial view, the knees should be set squarely on top of the cannon bones and should not be offset. However, this is not shown by Tommy. This causes uneven loading forces through the bones of the carpus joint, leading to potential injury within the cartilage of the joints and the bones. Cranially, Tommy's right hoof is laterally rotated, causing a slight toe-out conformation. This rotation, paired with the flatter hoof conformation, causes increased horizontal braking and vertical ground reaction forces through the distal forelimb. This predisposes the limb to lameness due to increased loading forces and thus increases the opportunity for damage to the distal forelimb. Differences in toe conformation may further indicate lameness, as it may be caused by postural preferences when the horse is standing or moving, leading to uneven wear of the hooves. Horses with a reduced dorsal hoof wall angle are also more likely to place the foot down toe first instead of the ideal flat foot placement. The pastern should be sloped at approximately 45 degrees when measured from flat ground. His left forelimb pastern angle measures at 48 degrees and his right at 51 degrees. Enlargement of the sesamoid, joint pain, and synovial effusion of the tendon sheath can occur due to increased jarring upper leg and joints caused with a too straight pastern angle. This is because the pastern is not sloped enough to absorb the impact as effectively. Navicular syndrome can be a consequence of straighter pasterns due to the long pastern being in contact with the short pastern bone and therefore leading to erosion of the bone or bony spurs forming. In both lateral and cranial views, Tommy's hoof in his right forelimb is flatter than his left, with his right dorsal hoof wall angle at 50.8 degrees and his left measuring at 55 degrees. The average hoof wall angle for thoroughbreds is between 50 degrees and 55 degrees. Despite both forelimb hoof wall angles falling in this range, the asymmetry may be significant. Uneven hoof shape may be due to postural or loading preferences and can lead to uneven loading forces and ground reaction forces through the limb, potentially predisposing one limb to musculoskeletal issues over the other. In the right forelimb, the plumb line, when held from the tuberous spinae of the scapula, should evenly bisect the limb to the fetlock joints, ending at the bulbs of the heel. In Tommy, the plumb line evenly bisects the proximal aspects of the limb, however, upon reaching the carpal joint, it falls more cranially, continuing in this trend through the distal aspect of the limb before ending at the bulbs of the heel. Such deviations in the lateral view would suggest that he shows carpal flexion over the knee. This can also lead to overstretching of the collateral ligaments and increased wear on joints, increasing the risk of musculoskeletal conditions such as tendinitis. This conformational defect could have been a predisposing factor to the tendon injury he sustained in 2019. The left forelimb also shows a similar trend in relation to the plumb line, though it is not as severe. Under palpation of the palmar aspect of the metacarpal region, the right forelimb appears to show some inflammation. Also, the right forelimb has a fibrotic scar within the flexed tendons, which correlates to his historic tendon injury in his right forelimb. From the caudal aspect, the hocks deviate medially from the midline, suggesting it is tarsus valgus. Though the angle of the image makes it difficult to determine whether the hind limbs are rotated, this toe-out conformation may suggest minor lateral rotation of the distal hind limbs. However, many thoroughbreds have this conformational trait, so it may be considered common. The length from the stifle to the point of hock should equal the length from the point of hock to the ground. In the left hind limb, his stifle to hock measures 61 centimetres, and his point of hock to floor measures 63 centimetres. In the right hind limb, the stifle to point of hock measures 59 centimetres, and the point of hock to floor measures 66 centimetres. Taking Tommy's average tibia length of 60 centimetres, this is accurate with the average tibia length recorded in thoroughbreds. suggesting that the distal hind limb length is longer than average. Tommy's hock angles measured 134.9 degrees in his right hind limb and 135.4 degrees in his left hind limb. This is approximately 25 degrees less than average thoroughbred at 160 degrees. The more angulated hocks may lead to the hooves being held too far under the body, camped under, increasing stress through the tarsus joint and the collateral ligaments, predisposing the horse to musculoskeletal issues such as bog and bone spabbing. Whilst horses with a smaller hock angle find it easier to step under themselves, they may have decreased strength in the hind limbs, thus making it harder to work through from behind. When standing, Tommy has a hind fetlock joint angle of 145 degrees in his right and 146.9 degrees in his left. In thoroughbreds, the average angle is shown to be 149.84 degrees. Tommy's fetlock angle is slightly more acute than the average thoroughbreds. This may only be a minor conformational defect. This causes more strain on the flexor tendons and the suspensory ligament, potentially leading to issues such as tendon and ligament damage. This more acute angle may be due to his long pastern length. The hind lump plumb line, when helping to the ischiae and viewed laterally in both limbs, should pass through the point of the hock and follow the plantar aspect of the cannon bone down to the fetlock and end just behind the bulbs of the heel. As he is camped under, it runs behind both the cannon bone and the bulbs of the heel. Sickle hocks may predispose the horse to hock osteoarthritis due to uneven wear on the joint surfaces or strain of the tarsal plantar ligament. Tommy shows some atrophy on his right hind limb, potentially indicating a lameness within this limb. Atrophy usually occurs due to disuse. A horse will be less likely to use a lame limb as weakly as his hand limb. In relation to his height, Tommy's trunk length is 4 cm shorter than his height. Trunk length and height from floor to the highest point of withers should be equal. Proportionally shorter back allows the dorsal spinous processes to sit closer together, which is considered to allow the back to carry more weight. Whilst Tommy's back may appear lordotic from static assessment, this may be due to lack of muscle across the dorsal spinous processes and abdominals, as he's been out of work for several months. This may mean that he's less able to support the weight of his trunk, which may predispose into musculoskeletal issues such as kissing spines. Whilst walking on hard ground, Tommy showed average stride lengths of 201.92 cm in his left fore and 198.62 cm in his right fore. There was little difference between his hind limb stride lengths, with a difference of 1.41 cm. Tommy shows some medial circumduction of his right fore in walk and trot on all surfaces. During forelimb protraction, the leg appears to twist at the carpus and the foot is placed more laterally than his left fore. In addition, both left and right hind limb shows slight lateral circumduction being placed medially. On hard ground, Tommy is shown to have a shorter stride length in his right fore compared to his left fore, being 3.3 cm shorter in walk and 2.28 cm shorter in trot. In trot, he showed average stride length of 274.20 cm in his left fore and 271.92 cm in his right fore. Additionally, when viewed cranially, there is a slight head nod when the left forelimb lands, further signaling lameness in the right forelimb. This is consistent with Tommy's clinical history, which may have led to weakness within this limb. Following the forelimb plumb line's findings, uneven loading of the structures in the right forelimb may lead to uneven stride lengths. Greater variations between average stride length and the hind limbs can be seen, with a difference of 11.19 cm. In both walk and trot on soft ground, Tommy shows shorter stride length in his right fore and hind limbs. His right forelimb stride length is 3.05 cm shorter than his left. His right hind limb stride length is 3.23 cm shorter than his left. This is consistent with earlier findings, showing he appears slightly lame on both his right fore and hind limb, due to a trend of short stride lengths in the presence of the head nod. When trotting on soft ground, Tommy had a greater difference in stride length in his forelimbs compared to his hind limbs. In his forelimbs, there was a difference of 7.72 cm, with his right forelimb having the shorter stride length. When viewed cranially, the head nod seen when trotting on hard ground becomes less visible. There are very minimal differences in the hind limb stride lengths, with a 1.24 cm difference. The flight arcs of all limbs in walk and trot on hard and soft ground appear even, with only minor differences seen in the stride lengths across the gaits. When backing up on soft ground and viewed caudally, Tommy drifts to the right. Ideally, he should back up in a straight line, which may indicate a gait deficit, which could be related to neurological diseases. When performing tight circles on hard and soft ground, Tommy is shown to cross his inside hind limb in front of his outside hind limb in both directions. This is the ideal movement. In his forelimbs in both walk and trot, Tommy places his hoof down toe first rather than a flat foot placement, causing uneven wear on the hoof wall around the cranial and medial aspect. Abnormal loading on the hoof may predispose lameness and may be an indicator of pain in the heels. None of the other conformational parameters considered in the study correlate to foot placement, meaning that foot placement is independent of other conformational traits seen more proximally in the forelimbs. This study also found that horses with toe-first foot placement in the forelimbs is closely associated with the more acute dorsal wall angle of the hoof, which is consistent with our findings. Finding toe-first has also been shown to be more common in horses with tendinitis of the superficial and deep digital flexor tendon. Overall, Tommy shows some conformational defects which may contribute to the faults seen in his dynamic assessment. His tendon injury history may have led to a weakness in his right forelimb, which may further contribute to lameness issues.